because of that, some herbs probably get out quickly, and others may accumulate in the body for a longer time.
Correct.
So,
Correct.
right. So I would like to know more from you about excretion in the way Ayurveda explains excretion.
Excretion involves elimination of the herbs after they are digested completely. And Ayurveda does recognize the importance of a balanced excretory system, an efficient excretory system, in ensuring that the body removes the metabolized substances without causing toxicity. And that's why this helps maintain harmony in the body's internal environment. So, for example, if somebody is consuming triphala, right? The body metabolizes it, the active constituents are released, and beneficial compounds get into the bloodstream. And as these compounds circulate throughout the body and they give different therapeutic effects on various organs and tissues, and once this purpose has been completed, they need to be safely eliminated from the body to prevent any potential buildup or toxicity, right? And that is why Ayurveda also talks about the role of excretory organs like kidneys, like liver, like colon and skin in elimination of these metabolized substances. And it has always focused on, like Ayurveda is not about, people say detox, right?
Yeah.
Our human body is perfectly capable of a natural detox. So provided there is a healthy liver, there is healthy colon, skin, and kidneys are functioning properly. And when we say that Ayurvedic treatments for detox, it actually means that it is just helping these organs like liver, kidneys, colon, and skin get better. And thereby they can do their job of elimination of these toxic and metabolized substances. That is what detox means. It doesn't mean that Ayurveda herbs is going inside and just doing something different. So proper functioning of these organs ensures that there is timely and efficient removal of waste products, toxins, and excess substances from the body. So kidneys filter blood and they excrete waste products in the form of urine. Liver processes toxins and metabolic byproducts, and it facilitates their elimination via bile secretion and feces. You just mentioned this. So what Ayurveda is doing is it is just supporting the health and functioning of the excretory system through dietary changes, through lifestyle practices, through the herbal remedies that are actually given in phase 1 treatment as well, and through the panchkarma or the biodetox therapies that we spoke about. So Ayurveda helps maintain this internal balance and prevents the accumulation of harmful substances. Now, because of this, like I said, if the detox organs or the excretory organs are working properly, this ensures that the metabolites will get out through a proper channel, and the body remains in harmony with external and internal environment. So, yeah, this is just brief about my thoughts on the excretion concept.
Yeah. Again, great explanation, and I agree with you, like, totally, that our bodies, if maintained in balance, if we are in a balanced state, our bodies are capable of taking care of excretion normally. And the detox is a normal phenomenon which translates into excretion in Ayurveda. And it's so the way the whole world is talking detox or detoxification is nothing but excretion using the various organs in our body, like you just discussed, kidneys and liver and skin, which is the largest organ, of course. So I know the concept of detoxification has taken a new shape and size lately, and even to use the word detox becomes totally misunderstood, right? If I say it. So I think we should start saying excretion, maybe, I guess. I don't know, but I agree. And the use of these panchakarma pathways, like we talked yesterday, in our previous podcast, is basically to bring the body into balance, and then the body can do its excretion pathways as it's supposed to do, only for people who are not in balance, right? And also maybe we have some concepts in Ayurveda for seasonal variations and some daily rituals, but those are also to taking into account the daily imbalances one can feel, right? If some wrong food has been taken or something has happened or you got a cough, which is usually a very transient state of imbalance, because you'll get rid of the cough, then you will feel better. But during the cough, there could, like if you have a cold, there could be some different ways of detoxing ourselves, but that's just to eliminate the germs and also the buildup of mucus. But it's not the way the detox has been presented right lately with Ayurveda. I feel it was a good discussion the way you discussed, and laying emphasis that our bodies in balance are totally capable of excretion and taking care of ourselves, right? So that was a good, I love that discussion. So what do you think are the factors that influence these the bioavailability now of these Ayurvedic substances once all this happens?
A lot of them, especially in the current scenario where people are talking about how the quality of the herbs or quality of the formulation is, how potent, how fresh, and how non-toxic and pure are the herbs that are used. All of this impact bioavailability. So if that's why it's important that the practitioner sources herbs from reputable suppliers, to ensure that the active constituents are there in their natural form, to enhance absorption and effectiveness. And I think a lot of people don't know this, but there is a concept of samskara in Ayurveda. And this plays a very crucial role in enhancing bioavailability of herbal formulations. So there are techniques like decoctions, fermentations, extraction of the formulations with appropriate carriers and adjuvants, which help release and concentrate the active constituents of the herbs and making them more available to the body. So a lot of herbs are actually, bhavna or samskara, like they're dipped in certain decoctions and fluids, Dr. Usha, for a certain time, and they're actually, how we use the pestle and mortar, they're actually manually rubbed on the stone, and that ensures fineness, and it improves the bioavailability of the formulation once it is consumed inside. And of course, it goes without saying that dosages, in what dosages, powders, tablets, decoctions, oils, syrups, etc. Dosage forms may have better absorption rates and be more suitable for specific conditions depending on the properties of the herbs. It's not always that practitioners prescribe tablets. They may give that tablet with a liquid. They may give the powder with an adjuvant and stuff like that. So it really depends on how the Agni of the patient is. I think I've observed this personally, and Ayurveda also talks about it, that Pitta Prakriti people, Dr. Usha, they have a very high ability to absorb and metabolize herbs. And I think Ayurveda also talks about it. And if you look at the Kapha Prakriti individuals, it's the actual opposite. They're very slow to absorb and metabolize the herbs. So results is always slightly slower. But the Pitta and definitely Vata Prakriti individuals, they have quick response to the herbs as well. Like they have, if there is a side effect that happens because of wrong dosage or whatever, Pitta and Vata Prakriti individuals are the first people to respond.
Yeah.
Right? This is also an observation. Yeah. So a lot of things, age, digestive strength, how the metabolic rate is, how many comorbidities are there in the patient. And I was talking to you about the timing of the administration. The meal timing, it really matters. It can affect the digestion, absorption, and metabolism. And again, I'm just talking about gastrointestinal health once again, because the health of the gut, including the integrity of the gut lining, gut microbiota, the digestive enzyme activities, all of these are crucial for absorption of herbal constituents. So that's why supporting gut health with dietary modifications, with lifestyle modifications, and digestive aids can enhance the bioavailability of Ayurvedic formulations. So there are a lot of factors I'm just summing up. before we go into the main line of treatment in any patient, always ensure that the gut or the Agni and the metabolism is back on track. And then you can start the actual anti-disease treatment. This is what I have learned from all of these years.
Yes, I feel you're talking. Yeah, this is like, I feel Ayurveda's, how Ayurveda employs various principles and practices to optimize the delivery of these therapeutic agents. I think that's very nicely you discussed that, including like various herbs and their formulation, so highest maximum effectiveness can be achieved, right? Like you were discussing Vata, Pitta, dosha person versus like a kapha person and how they actually will metabolize these herbs. It's so different, and how their therapeutic benefit or side effects will also be different because of their basic doshic imbalance. How do you think Ayurveda talks about optimizing the delivery of these therapeutic agents? Maybe you already kind of said a bit, but I wanted to discuss a little bit more on that as well.
If you want to watch the answer, stay tuned for part 4.